Hello, lovely people. Good day. How are you doing? This is NCLEX Target. Welcome to my channel where we break the content down for you to have a better understanding of whatever you need to pass the NCLEX exams. Today, we are going to look at oncology, cancer. You know that when the cells lost their normal growth controlling mechanism and the growth of the cell becomes uncontrolled, this is very dangerous because imagine you have a very nice cells, a very true cells, a very normal cells, and this particular cells has been replaced with what? With an abnormal cells. It becomes very dangerous to your health. And this one, it is very, very critical for us to look at it. Okay, we have two types. We have the benign and then we have the malignancy. The malignancy is what we are going to talk about because the benign is always located in one area. Okay, it does not spread. But when it comes to the malignancy, they spread from one area to the other area. We call this what? Metastasis. Now let us look at the root of metastasis. We have the blood-borne and then we have the lymphatic spread when it comes to cancer. Okay, now lymphatic spread is very rich. We say that it's the area where the early spread occurs. It means that this particular area, the lymphatic tissues, are those areas that the cancer spread at the early stage. And we also have the blood-borne. The blood-borne, you know that it is the commonest cause of what? Cancer spread. The blood-borne is the commonest spread of cancer spread. That means that it can move if the cancer from one area to the other area. Let's look at some areas of target where cancer can spread to. Okay, especially when a particular organ, okay, has been affected. Where is the area of target? Now, if you take the bladder cancer, for instance, you know that the area that they mostly target is the lungs. Okay, the lungs, they move to the lungs, the liver, the brain, and then also the bone and the pelvic structures. When you take the brain tumor, for instance, it mostly affects the central nervous system. It means that there's going to be what? A neurological deficit or problems. And then when you take a breast cancer, you know the breast is also closer to what? Closer to the lungs. And then we say that the lungs will be affected, the brain and the what? And the liver and also the bone. So most of the cancer, malignant cancers, they mostly affect the bone. It means that when it comes to blood production, there's going to be a problem. This is very, very important point to take notice of. Okay, and then we have the posterior CA. You know, the pelvic structures are going to be affected, the bone, the spine, the lungs, the liver, and also the kidneys. These become the areas where what? Any type of what? Cancer, okay, spread to, especially when it comes to the target. Okay, that is why we are doing what? NCLEX target. We look at those areas that NCLEX love what? Asking questions on. Okay, let's look at factors that can influence cancer. We have environmental factors, we have genetic factors, we have the physical factors, and then we have the chemical factors. We all know when it comes to the environmental factors, we talk about the chemicals. Okay, the chemicals, the industrial chemicals are very, very dangerous. And you know that those who are working at the mining areas and some of the industrial areas, they are mostly at risk for cancer, some of them, okay? So take note of that. And then tobacco use and alcohol use. You know, the environment can influence someone to take in alcohol, to take in what? Tobacco or smoking, okay? Especially when it comes to the peer groups. They are very, very dangerous when it comes to the influences of what? Alcohol and those kind of hard drugs and stuff. Okay, we also look at the physical. When it comes to the physical, okay, we can do what we talk about the ionizing radiation. And the ionizing radiation, we have what? S-rays, ultraviolet rays. Okay, and then we talk about the sun, the tanning beds, and also germicidal light. Now the sun, we'll talk more about the sun because that is NCLEX target. The sun. You know that from 10 a.m. to 4 p.m. you're not supposed to go outside, okay, with that covering the body, due to the fact that the sun rays that is coming are very dangerous to your health. Because of that, cancer can occur. So please take note, it is part of the NCLEX areas or NCLEX targets. Okay, and the tanning beds are those kind of gadgets that we use to warm ourselves during the winter seasons. Okay, those particular ray that comes has also a very serious effect on the skin. Okay, and they can cause cancer. It is very, very dangerous. And then germicidal light. Germicidal light is those ones that we use to drive those kind of germs and those kind of insects away. They are also dangerous because in as much as the insect is afraid of it, don't think that it's safe for you, because you are also part of living organism. That definitely is going to also affect your what? Your body. Take note of that. Because of that, they can also cause cancer. And then we have viral, oncovirus. Under it, we have Epstein-Barr virus, we have hepatitis B virus, and then we have human papilloma virus. Especially when it comes to cervical cancer, human papilloma virus, you can't take them away because they are all part of what? Cancer problems. And then H. pylori, Helicobacter pylori. This particular one is mostly the one that affect the gastric cancer. Okay, they mostly affect the gastric cancer, and the age is also part of it, especially when it comes to prostate cancer. You know, as you age, the body starts to degenerate, but this, okay, it can also cause what? Cancer. So this is the factors that influences what? Cancer cause. Now, let's look at diagnostic too. You know that biopsy is the one that we mostly use, is the definite, diagnostic tool when it comes to cancer. Okay, biopsy. Why? Because we have to take the sample for histopathology. We take the sample for histopathology, okay, and then we use this one to rule out any cancer cells. It is very, very important. And now take note, the biopsy, we can take the sample through surgery. All right, surgery is also part of the treatment of cancer. We can do it through surgery, and then we can also do it through needle aspiration. Okay, now with regards to the needle aspiration, because we are dealing with cancer, you know that the patient can bleed. So whenever you do needle aspiration, your duty as RN is to do what? Is to apply a sterile dressing, a firm sterile dressing, to be able to occlude the area to stop bleeding. Take note, it is also part of the NCLEX areas. It is very, very important. Now let's look at pain control. Pain control, you don't underestimate a cancerous patient when it comes to pain. Don't underestimate their pain, because they actually feel the pain, and pain is what the patient tells you. It's not what you observe. Okay, because pain is subjective. What the patient feels, it doesn't matter. In NCLEX, if you have given them the pain medication 30 minutes ago, you are entitled to give it. You assess the pain, and then if there's a need for you to call on the primary healthcare provider to increase the dosage, please take note. This is an NCLEX target area. Don't underestimate patient pain. Okay, let's look at cancer treatment. Now, when it comes to cancer treatment, this is also the NCLEX target areas. Take note of this. Okay, we have surgery. Surgery, we use it to debulk the organ that has been that the cancer has affected. Okay, so that we can control it with with whether chemotherapy or radiation therapy. So surgery is part of the control mechanism when it comes to cancer. Okay, so it's part of the treatment. We can use surgery, and then the two most important one is the radiation therapy, and then the chemotherapy. We'll talk about the chemotherapy because the chemotherapy is also part of the NCLEX areas. And take note, the chemotherapy, what happens is that in as much as it is killing the cancerous cells, it is also killing the true cells. That is why mostly it affects the immune system. The patient's immune system is mostly affected. Because of that, they have neutropenia. Neutropenia means that there is decrease in white blood cells. The cells that will fight against infections are also suppressed. Because of that, we need to pay attention to the patient health, especially in as much as infection is concerned. So what we need to do is that we need to protect the patient. The patient is not supposed to eat a fresh fruit because there's a neutropenia. The immune system is low. Fresh fruit is avoided in this patient, and then fresh flowers should not be placed in the patient's room. And then proper hand washing is very, very important, and then proper hygiene. Anybody who is coming into contact with the patient with respiratory tract infection is also avoided. Okay, or the person should wear masks because their immune system is low. That is whenever there is neutropenia due to the chemotherapy. And then you know that vomiting is also common with them. And then when it is too severe, it means that the primary healthcare provider is supposed to be called because intervention is needed in prioritization. In NCLEX, it is very, very important to look at it. Is the vomiting severe or not? If it is not severe, then ondansetron is okay. Even if it is severe, you still give ondansetron to reduce the vomiting. Take note of that. And then fluid resuscitation is very, very important in this particular case. And then alopecia, we are going to talk about it because the patient is going to lose the hair. And women always cherish their hair. Because of that, you tell them about the available wig. In NCLEX, take note of this. It is part of the NCLEX areas. All this chemotherapy management we have spoke about, they are the NCLEX target areas. Take note of that. So you have to let the patient know that there is available wig at the store, so he or she can go there to purchase them. It is very, very important to advise the patient. And then the patient diet is also very, very important in this regard. Okay, now that is just by the way when it comes to chemotherapy. Let's look at radiation therapy, NCLEX target areas too. Okay, the side effect is fatigue. So you know that when there's fatigue, rest is very important, and then you have to protect the patient against any form of injury. Okay, because the patient is weak. Because of that, NCLEX, anytime the patient is weak, it means that protection against injury is very, very important. And then there's going to be alopecia, which we have also spoke about. Okay, now the types of radiation therapy, we have what? We have the external beam radiation, which is teletherapy. Okay, external beam radiation or linear beam radiation. Now, let me talk about this. Now, when it comes to the linear beam radiation, what you need to know is that the patient does not give out radiation. The patient does not emit radiation. Okay, so the rays, the radiation is coming from an external, source, and then it is headed, directed towards the area where the cancer is. So the patient does not give radiation. And one thing you need to know is that when it comes to the management of the area, there's going to be a mark, because it's the one that is directing us towards the treatment. So if there is a mark area, you make sure you don't clean the mark area. Take note, whenever you don't wash the area, and then when you are cleaning the irradiated area, you should clean it with what? With mild soap, not hard soap in NCLEX. Take note, not a hard soap, but a mild soap. And then you try to cover the area whenever you are working under the scorching sun, because the effect of the sun is also part of the cancer cause. So because of that, you should protect the area. Don't wash the marked area, okay, because these are the NCLEX targets. Take note of that. Okay, now that is just by the way of the external beam radiation or teletherapy. Now the other type of radiation is the internal radiation, brachytherapy. BRACHYTHERA, PY. Okay, we call it brachytherapy. Now, when it comes to this management, we have two types. We have the unsealed and the sealed. Because here, what happens is that the radiation is within the patient. So, and then the patient, when it comes to the sealed one, the patient gives out radiation. But when it comes to the unsealed, take note, let me talk about the two types of the brachytherapy. We have the sealed and the unsealed. I'm going to talk about the unsealed. Now, with the unsealed one, okay, it is through injection, through IV, through cavity. We insert through cavity or we give it orally. And because of that, the patient does not emit radiation, but the fluid of the patient is contaminated. Any fluid, be it sweat, saliva, sweating, or urine, any fluid that is coming from the patient has been what? Has been contaminated. So please, you handle the patient with care. Why? Because the patient linens are very, very important. The patient linen are very important. Please, handle the patient linen with care. Don't nurse the patient with your bare hand in NCLEX. And then you keep all linens in the room. And then when the patient go to urinate, tell the patient that, okay, he should flush it twice, and then you have to isolate the patient because the patient fluid is is contaminated. Take note of that. It is very, very important. So know how to manage the unsealed and know how to manage the sealed one. Now let's talk about the sealed one. This one, the patient radiation is within is implanted into the patient, and the patient give what? Radiation outside. The patient emits radiation. Take note. Don't let any pregnant woman to come closer into the patient room. Take note. Children under 16 years are not supposed to go into the patient room because their immune system is low. And then you should stand at least 6 feet from the patient because the patient emits radiation. 6 feet. And then you will limit activity for about 30 minutes. That means that you have to stay in the patient. You have only 30 minutes to stay in the patient room. And then you should wear what? A dosimeter film badge. Okay, this one will read the amount of radiation you have what accumulated. And also take note, it is very, very important. You wear what? A lead shield whenever you enter into the room. All visitors are supposed to wear a lead shield. It is very, very important. Okay, when it comes to the sealed radiation, please, it is very, very important. Pregnant women. And then what happens is that you have to what? Change staff. If a nurse, if someone, a nurse nurses the patient today, okay, the following day, different nurse is supposed to nurse the patient in NCLEX, because they have a very, very important, what do you call it, things that needs to know. Why? Because their immune system and the radiation. If you constantly expose them with to the radiation, it's going to affect them, and they are likely to have a cancer, because in as much as the radiation is killing the cancer cells, it is also destroying the normal cells. And if they destroy the normal cell, it means that there is probability that any person, okay, who comes into contact with the sealed radiation, okay, there is a likelihood that that person can have the effect. And now, sometimes when it comes to the sealed radiation, okay, we know that we insert it into the patient's body. So if we insert into the patient body, what can happen is that they can fall off. They can be removed. And when they are removed, take note, this is the management tool. Use a long handle faucet to take it. And when you take it, you put it in a lead container, a tight lead container. After that, okay, you call those who are entitled for it to come and take it out. And then what mostly happens is that all the patient linens are supposed to be in the room until what? Until the source has been seen or has been taken off. Why? Because there might be a likelihood that the source of the radiation may fall on the bed, or it may fall on the linens, inside the linens, and and you don't see it. So put all radiations, the linens inside the patient, inside the patient room, so that okay, after the management has occurred, okay, we'll be able to identify it and remove. It is very, very important. Now, one thing that I will tell you under the unsealed one is also that with the unsealed one, you said that when you remove the within 48 hours after injection, okay, we expect that it's supposed to come out from the system. Okay, 48 hours. So after 48 hours, the patient's secretions are no more contaminated. Okay, it is also part of the NCLEX areas. Ladies and gentlemen, this brings us to the end of today's section. Please take note, NCLEX is doable. NCLEX is doable. It is very, very important. Okay, NCLEX is doable. Take note, NCLEX is doable. Please don't forget to hit on the subscribe button and also the notification button, okay, so that anytime we have a content, you can have access to it. Have a nice day. Bye bye. Let's meet, okay, the other time to talk about the part 2. Thank you very much.